This is the PowerPoint for Chapter 1, An Introduction to the Human Body. First, let's define anatomy and physiology. These are the two branches of science that deal with the body's parts and function. So anatomy is the science of body structures and their relationships. Physiology is the science of body functions. Structure and function are closely related. Understanding of one leads to a better understanding of the other. Each of these can be studied on many different levels, as shown on page 2 in your textbook. And the approach that we're taking is systemic anatomy and physiology, where we study the body structures system by system. And this is the table from your textbook, and you can see on the left all the different types of anatomy, levels that you can study anatomy. Histology is the microscopic study of tissues. Gross anatomy is a study of structures that can be seen without a microscope. Systemic anatomy is the structure of specific systems. Regional anatomy, you study everything about a particular region, and so on. And the same is true for physiology, which you can see on the right hand of this table. You can study physiology on many different levels. Again, the approach we're taking is systemic, studying systems. We have levels of structural organization in the body, and each level builds on the level below. At each level, interactions occur that give rise to the next level. And so we can see these: chemical, cellular, tissue, organ system, and organism. So if we look at each of the levels, the most basic one was the chemical level. Atoms are the smallest units of matter, and molecules are two or more atoms joined together. And molecules interact with each other to give rise to the next level, which is the cellular level. Molecules combine to form cells. Cells are the basic structural and functional units of an organism. All organisms are composed of one or more cells. Tissues are groups of cells with similar structure and function, including the materials surrounding these cells. There are 4 basic types of tissues: epithelial, connective, muscular, and nervous. The organ level. Tissues interact and join to form organs. And organs are structures that are composed of 2 or more different types of tissues. And they have recognizable shapes, and they have very specific functions. Organs don't act independently of each other. Many organs will cooperate to form an organ system. So this would be a group of related organs with a common function. For example, in the digestive system, we have teeth, tongue, stomach, liver, and I can go on, but all of these structures are going to be working together to accomplish a major function for the body: digestion. There are 11 organ systems in the body, and these are shown on pages 4 through 7 in your textbook. We'll study some of these in A&P 1 and some of these in A&P 2. And so our organ systems will then interact to form a functioning, living organism. So an organism is any living individual, and of course, we are made of many cells, so we're multicellular. Some organisms consist of only one cell. They would be called unicellular. In health, all parts of the body function together in a process called homeostasis, where conditions in the body are held within a very narrow range of normal values. So the values can fluctuate normally within this range. When they get outside of that range, then the body will have to do something to bring these values back into the normal range. So before studying homeostasis, let's look at the organ systems that we were talking about in the following slides. Integumentary system, skin and associated structures, the skeletal system, muscular system, and nervous system. This brings us through Anatomy and Physiology 1. In Anatomy and Physiology 2, you will study the endocrine system, cardiovascular system, lymphatic system, respiratory system, digestive system, urinary system, and the reproductive systems. All organisms show the basic characteristics of life, so let's just review 6 basic life processes, the things that distinguish living things from non-living things. Metabolism is the sum of all the chemical processes that occur in the body. There are 2 sides of metabolism. There's catabolism, where you're breaking down more complex molecules to simpler ones. For example, if you're breaking down glucose in order to extract the energy from it. And there's an anabolic side, the building up side. Maybe we're taking amino acids and building them into a complex protein. So metabolism is the sum total of all these chemical processes. And metabolism is reflected in vital signs like blood pressure, body temperature, etc. Another basic life process is responsiveness. This is the body's ability to detect and respond to changes in the internal and external environments. Movement, which includes any motion, the movement of substances within cells, the movement of substances throughout the body, or movement of the entire body. So movement at any level. Growth, which involves an increase in body size due to an increase in the size of existing cells, which is called hypertrophy, an increase in the number of cells, which is called hyperplasia, or both. Differentiation, the development of a cell from an unspecialized to a specialized state. Cells have specialized structures and functions that differ from their precursor cells. Everybody has heard of stem cells. Stem cells are unspecialized. They have the ability to give rise to many different types of cells that will be more specialized. So stem cells undergo differentiation to become specialized cells, muscle cells, gland cells, etc. And of course reproduction, which is the formation of new cells or the production of an entirely new individual. We will look at growth, repair, and replacement as mechanisms of reproduction. Homeostasis is a condition of equilibrium or balance in the body's internal environment, the maintenance of a relatively constant internal environment. Homeostatic mechanisms, mechanisms that maintain homeostasis, will maintain variables like body temperature, blood pressure, blood glucose, etc. near a set point, within a narrow range. Keeping these variables within that narrow range is compatible with maintaining life. Some examples would be blood glucose levels ranging between 70 and 110 milligrams of glucose per deciliter of blood. You can see that there's a range there. As long as the blood glucose levels are within that range, cells in your body are happy. If it gets too low or too high, then your body has to do something about that to bring it back into its range. Body temperature is maintained near 98.6 degrees Fahrenheit. Shivering and sweating can bring the temperature up or down within the normal range. An important part of homeostasis is the regulation of the volume and composition of body fluids. I think everyone has studied osmosis in general biology. Well, osmosis is very important because cells have a certain amount of fluid within the cell, and they are bathed with a certain amount of fluid outside of the cell. Intracellular fluid is this fluid within cells, and if we looked at total body fluid, intracellular fluid accounts for about 2/3 of it. Extracellular fluid is, of course, that fluid that is not contained within cells. Interstitial fluid is extracellular fluid between cells and tissues. Sometimes we call it tissue fluid. Other extracellular fluids are contained within vessels and cavities, like plasma, lymph, cerebrospinal fluid, and things like that. The composition of these fluids can change as substances move into and out of them. And you're going to learn much more about body fluids in A&P 2. If we look at the control of homeostasis, it is by feedback systems. Body conditions are constantly monitored. Each monitored variable is termed a controlled condition. All body systems contribute to homeostasis, but especially the nervous system for those short-term, moment-to-moment types of changes, and the endocrine system, which is responsible for longer-term changes. Nervous system uses neurotransmitters to transmit information from nervous cell to nervous cell. The endocrine system releases hormones that take a little bit longer to work, but they have longer lasting effects. There are three basic components of feedback systems: a receptor, a control center, and an effector. The receptor is a body structure that monitors changes in a control condition, and the receptor will send this information as an input to the control center. So this information is sent to some place in the control center, which would be include the brain and the spinal cord, which would then assess this information. So the control center is in the central nervous system. It sets the normal range of values to be maintained, and it is constantly evaluating the input received from receptors and generates an appropriate output command. Is the change in the condition enough to warrant the body to do something about it, or are we still within the narrow range and everything's still okay? The effector receives the output command from the control center, and it produces the response that changes the control condition, so it brings about the desired effect. Nearly every organ or tissue can serve as an effector. Some examples would be body temperatures dropping. That would be detected by the receptor. That would send that information. The receptor sends that information to the control center. In this case, it's the brain. And the brain will compare the incoming information to the set point for body temperature, then sends an output command to the skeletal muscles to contract. The muscles, or the effectors in this case, bring about the desired effect. Shivering occurs to generate heat, and the body temperature rises. The control of homeostasis is usually accomplished by negative feedback systems. Negative feedback systems are homeostatic. In other words, they maintain homeostasis. They resist deviations from a set point. And negative feedback systems regulate conditions in the body that will remain fairly stable over long periods of time. Like body temperature, blood pressure, blood glucose. Other examples would be heart rate, and so on. And here, again, we'll use body temperature as our example. Shivering will increase body temperature when it gets too low, and sweating will get rid of body heat when the temperature is too high. And so you can see that in each case, the body is trying to bring that variable back within normal physiological limits, within that normal range to the set point. Just like the thermostat in your house. When the temperature gets too high, then the air conditioner is going to come on to bring the temperature in the house back to wherever you set it, your set point. Positive feedback systems are not homeostatic. They do not maintain homeostasis. The deviations for the set point get ever greater, and you get more and more away from the set point, continuing until this process is interrupted by some outside force. Positive feedback systems are rarely seen in healthy individuals, but they do occur in some situations. Normal childbirth, where the uterine contractions are getting harder and harder, they're continually increasing. They only stop when the baby's born. That's the event, the outside force, that will stop uterine contractions. Lactation, which is milk production, milk increases with demand, and you produce more and more milk until the baby is weaned. That's the event that stops milk production. Positive feedback mechanisms are used for situations that do not happen very often or do not last very long. So They're temporary and don't occur very often. Positive feedback mechanisms are not good for maintaining homeostasis. When the normal equilibrium of body processes are disrupted, you can have moderate imbalances or severe imbalances. Moderate imbalances, you might have a disorder or a disease with recognizable signs and symptoms. And the difference between a disorder and a disease is that the disorder is due to some structural abnormalities that produce a certain condition, whereas disease, of course, the body is fighting off some sort of disease-causing organism. But these imbalances have recognizable signs and symptoms. Signs are measurable. They are objective changes, such as a fever or swelling, something that can be measured. Symptoms, on the other hand, are subjective. These changes are subjective, headache, nausea, things like that. You have to try and describe to someone how bad your headache is or how nauseous you feel. And then, of course, if the imbalance is severe enough, death can result. So now let's talk about basic anatomical terminology, which is a common language referring to body structures and their functions. Anatomists use standard anatomical position and special vocabulary in relating body parts to each other. We'll look at body positions, regional names, directional terms, planes and sections, and body cavities. Here we see in the middle of the slide a person in anatomical position. The body is upright, standing erect, facing the observer. The head and eyes are facing forward, feet are flat on the floor and facing forward, and the upper limbs are to the side with the palms turned forward. Over on the right here, you do see someone from the rear position, a posterior position, or posterior view of anatomic position. So, as we saw on the last slide, anatomical position is the body upright facing forward. There are terms for reclining body. The prone position refers to when the body is lying face down. Supine position, the body is lying face up. The body can be divided into several major regions. We have the head with the skull and the face, the neck, the trunk, which is divided into the chest, abdomen, and pelvis, our upper limbs, and our lower limbs. We're going to look at directional terms which describe the position of one body part relative to another, and all refer to a person in anatomical position, whether or not they actually are at that moment in anatomical position. These directional terms are usually grouped in pairs with opposite meanings. For example, anterior is the front, posterior is the back. And these directional terms only make sense when used to describe a position of one structure relative to another. So you have to say what the relationship is between one structure and the next. For example, the knee is superior to the ankle. It's above the ankle. So let's look at common directional terms. Superior, cranial, cephalic, all can be used interchangeably to mean toward the head. And so you can see over here, if we're going in a superior direction, in an upright human, then we're also going towards the head. So cranial and cephalic can also be used to signify superior. Inferior, if you're going away from the head, going in a caudal direction. And for a human, this is also inferior or below. Anterior means front, posterior means rear. When you're looking at a person in anatomical position, you are looking at their ventral surface. So anterior and ventral can be used interchangeably. When you're looking at a person from the rear, you're looking at the dorsal side of their body, so those terms can be used interchangeably. Medial means nearer to the midline, whereas lateral means further from the midline. And you can see this midline here dividing this person into equal right and left sides. And if you're going away from that midline, you're going in a lateral direction. If you're going towards that midline, you're going in a medial direction. Now let's look at limbs that are attached to the trunk of the body. If we are moving in a direction that is closer to the attachment of that limb to the trunk, we're moving in a proximal direction. If we're moving away from that attachment, we're moving in a distal direction. I always remember distal, distant. My fingers would be distal to my elbow. They are more distant from the point of attachment to the body. Ipsilateral and contralateral. Ipsilateral means the same side of the body. So this limb and this limb are ipsilateral. Over here, this limb and this limb are contralateral. Superficial and deep. This is a section through the trunk of the body. This is the heart. These are the lungs. This is a vertebra here, just to get your bearings. Anyway, superficial and deep. Superficial means towards the surface, and surface of the body here, and deep would be further away from the surface, deeper. And so here is a table from your textbook which has all of these directional terms in that we just went over, and you are responsible for knowing all of these directional terms. This is a nice table because it gives you the term, the definition, and an example of its use. Now we also have regional names that describe various regions of the body. And you can see this, this person here has many regions labeled. You are responsible for the regions in bold print: cephalic, or head, cervical, neck, and the trunk, which is divided into the thoracic, abdominal, and pelvic regions. But you can see when we're looking at the head, we could be talking about the cranium of the skull or the face, so cranial and facial. The neck is cervical, and then just going down the list very quickly, cubital means elbow, carpal means wrist, patellar is the front of the knee, orbital, the eye, thoracic, chest, inguinal refers to the groin. And here we have, we continue on with our regional names. Metacarpal means palm. Plantar means the sole of the foot. Buccal means cheek. Axillary area is the armpit. Femoral is the thigh. Gluteal is the buttock. Tarsal refers to the ankle. And digital or phalangeal refers to fingers and toes. Let me go back for just a second. Oh, darn. Okay. So many of these terms do make sense. Some of them you would have to memorize, but again, I'm not going to ask you for all of these terms on a test, but it's in your best interest to become familiar with these. When you're later in your studies, when you're trying to learn the names of blood vessels, nerves, things like that, very often they're named for the region of the body in which they're found. Now let's talk about body planes. Body planes are imaginary flat surfaces that separate the body or body part into portions. There are three major planes at right angles to each other. They're sagittal, which is vertical, transverse, which is horizontal, and frontal, which is coronal, or also known as coronal. So first of all, let's look at sagittal. There are two categories for sagittal planes. There's mid-sagittal, which goes right down the midline, dividing this person into equal right and left sides. Parasagittal would be a plane to one side or the other of that mid-sagittal plane, and it's still going to divide the body into right and left sides, but now those sides are unequal. Frontal or coronal planes divide the body or organ into anterior, front, and posterior or back portions. And it's very difficult to see in this figure because we're looking at this person head on. But you would just slice this person in a coronal or frontal plane so that you would have the front portion of this body and the back portion of that body. Transverse planes are horizontal. They divide the body or organ into superior, upper, and inferior portions, lower portions. And oblique planes pass through the body or an organ at some angle other than a right angle to the long axis of the structure. All of these other planes intersect each other at right angles, but the oblique plane, if you look at the long axis, for example, of this leg, there are no angles here that are 90 degrees. And here you can see a body structure, an organ, the brain, using these different planes. This is a mid-sagittal section of the brain. You can see that we have divided into equal right and left sides. Here you can see the frontal or coronal brain section. We divided into front and rear sections. And here is a transverse or horizontal brain plane dividing the brain into an upper, superior, and lower or inferior part. Body cavities are enclosed spaces within the body that help protect, separate, and support internal organs. Your internal organs are located in cavities. There are two major body cavities. This yellow one here is the dorsal cavity, and the brain and spinal cord develop in that cavity. The remaining body organs are in the ventral body cavity that you can see in blue and green here. And both the dorsal and ventral cavities have subdivisions. If we look at the dorsal cavity, we can see that there's a cranial cavity and a vertebral canal within that dorsal cavity. The cranial cavity houses the brain, the vertebral canal houses the spinal cord. Now let's look at the ventral cavity. And we can see here there's a blue portion and a green portion color-coded with this chart. In blue, everything above this diaphragm is blue. We're in the thoracic cavity, or the chest cavity. There are some subdivisions of that, and there will be another slide that I'll show you that shows it a little bit in more detail. But you have a pleural cavity. Actually, you have two pleural cavities. Each pleural cavity surrounds one lung. Then we have the pericardial cavity, which surrounds the heart. And the mediastinum is not really a cavity, but it is a region. It's that part of the thoracic cavity that lies between the two lungs. So everything in the chest, except for the two lungs, lies in the mediastinum. Below the diaphragm, we have the abdominopelvic cavity, which can be subdivided into the abdominal and pelvic cavities. In the abdominopelvic cavity, the abdominal cavity contains most of your digestive organs. In the pelvic cavity, you have the urinary bladder, portions of the large intestine, and your internal organs of reproduction. So let's take a closer look at these. We've already described the dorsal cavity, cranial cavity, formed by cranial bones protecting the brain, and the vertebral or spinal canal, which protects the spinal cord. These cavities are lined by membranes, and when we get to the nervous system, we will study a little bit further the membranes that line the dorsal cavity. These are the meninges. Then the ventral body cavity, as we saw, is divided into thoracic and abdominopelvic by this diaphragm. Here you can see a detail of the thoracic cavity. Here is your diaphragm, so everything above it is going to be in the thoracic cavity. So you can see the subcavities within the thoracic cavity. In the center here, we have the pericardial cavity. This is the heart, and this red area here represents the pericardial cavity, which is a fluid-filled space that surrounds the heart. Here's one lung, here's another lung. Each one of these lungs is surrounded by the pleural cavity, in purple here and in purple here. So our pleural cavities are fluid-filled spaces that surround the lungs. And then this dashed line here outlines the mediastinum, which is the region of the thoracic cavity between the lungs. Again, this contains all thoracic organs except for the lungs. And so you would have your heart, your esophagus, trachea, thyroid gland, etc., located within the mediastinum. And this is a transverse plane. You can see the level, and so we can see the lungs and the heart here. Well, the abdominopelvic cavity, as we said before, is below the diaphragm, extending from the diaphragm down to the groin. It's encircled by the abdominal wall and the bones and muscles of the pelvis. So our two portions here, abdominal cavity and pelvic cavity, there's no single structure like the diaphragm to separate these two cavities. However, as we described before, most of your digestive organs are in your abdominal cavity, and bladder, reproductive system, portions of the large intestine are in the pelvic cavity. All body cavities are lined by membranes, and we can talk about several different types of membranes. First of all, mucous membranes line body cavities that open to the outside of the body. The digestive tract, the reproductive tract, the urinary tract, the respiratory tract. So anything that communicates with the outside of the body, any of these cavities would be lined by mucous membranes. They're moistened by mucus. Body cavities that do not open to the outside of the body are lined with serous membranes. So these internal cavities that we were talking about, pleural, pericardium, abdominal cavity, these are all lined with serous membranes. These membranes adhere to the outer surface of the organs or the viscera, and then they kind of double back on themselves to line the body cavity wall. There's always two layers to a serous membrane. The visceral layer covers the organs or viscera within the cavities. So this layer always is in direct contact with the organs that are being lined. And then we have the parietal layer, which lines the cavity walls. And between these two layers, you have the actual cavity. This diagram here is actually from chapter 20, I believe, in your textbook. But it's a nice little graphic to show you the relationship of a serous membrane with the organ that it's lining. Here's a fluid-filled balloon. Here's the heart. We're going to push this heart into this fluid-filled balloon, and you can see how one wall of this balloon is going to end up in direct contact with the heart. Then there'll be a little fluid-filled space, and then there is an outer membrane lining the cavity. So this is the pericardium, the serous membrane that lines the heart. And so we can see there would be a visceral pericardium and a parietal pericardium. There are only 3 serous membranes in the body. We have pleural membranes that are the serous membranes that cover the lungs. And of course you're going to have both visceral pleura and parietal pleura. Visceral pleura are going to be right on the lungs. The parietal pleura is going to line the outer wall of their cavity. The pericardial membrane, we just saw that. That's the serous membrane that covers the heart. And the peritoneal membrane, or the peritoneum, is the serous membrane that covers the abdominal organs. So you have a visceral peritoneum that is going to be draped over the surfaces of these visceral organs, these abdominal organs, and then the parietal peritoneum is going to line the abdominal cavity wall. There are some structures that lie outside of the peritoneal cavity, like kidneys and adrenal glands and things like that, and so they are lined only with parietal peritoneum. And this again is a slide from, or an illustration from later on in your book for the digestive system. But we can see here the intestines and various structures, abdominal organs here. And so if you look at the little purple line here, okay, that's draped all over these, that little purple line there, that's the visceral peritoneum. And then we have this outer purple area here. We can follow it all the way down to here. I'm sorry. Let me get this in a good spot. Okay, so continuing on down here, you can see this is actually the parietal peritoneum. And here is structure. It's a lower portion of your colon, actually lies behind the parietal peritoneum. And so this is one of our retroperitoneal organs. Now the abdominal pelvic region can be subdivided to more accurately describe areas of pain or tumors or various types of damage and so on. Identification of quadrants and regions in the abdominopelvic cavity helps to have clinicians describe the location of many abdominal and pelvic organs. There are 4 abdominopelvic quadrants and 9 regions. So we have 2 methods of dividing up the abdominopelvic region. One divides that region up into 4 quadrants. The other method divides that same area into 9 different regions. And both of these methods are centered on the belly button or the umbilicus. So here we have the quadrant method. Here we can see 4 quadrants, right and left upper quadrant, right and left lower quadrant. Belly button would be right there. And please do note that when we name these things, it's the person's right and left, not your right and left. Okay, this method is used primarily by doctors to describe the location of tumors, pain, etc. And just as an example, here's the appendix right there. And so if somebody presents with pain in the lower right quadrant, then one problem that could be suspected is appendicitis. Now this is a more specific way of dividing up the same region. We have 9 regions here. It's kind of like a tic-tac-toe grid. Still centered on the umbilical region, on the umbilicus. So here we have the umbilical region, above it the epigastric region, your stomach is about in this area, and below it is the hypogastric region. On either side of the epigastric region are the right and left hypochondriac regions. So right hypochondriac, left hypochondriac. And you'll notice we're near the ribs, and the ribs have a lot of cartilage associated with them. Chondro refers to cartilage. So that's how these regions got their names. And then down here, you would be in the area of the lower back. So we would have our right and left lumbar regions. And then down here, we're near the pelvis, getting close to the groin. Right and left inguinal regions. If you remember, inguinal refers to groin. These are also called the right and left iliac regions, I-L-I-A-C, because the ilium is the upper portion of your hip bone. And so sometimes these regions are right and left iliac regions. And here you see side by side the two methods, and you should know both. Medical imaging involves techniques and procedures used to create images of the human body. They allow visualization of structures inside the body without the need for cutting the body open. It's also used for diagnosis of anatomical and physiological disorders. And conventional radiography, or x-rays, has been in use since the late 1940s. So that's when medical imaging began, but now we have so many more sophisticated techniques. The really good thing about these medical imaging techniques is that they're non-invasive. So they can be used to inspect different aspects of the body without actually cutting into the body. And so these are often done to assess structure and function and to look for the presence of disease. Palpation is gently touching body surfaces with the hands. Auscultation is listening to body sounds with a stethoscope. And percussion is tapping on the body surface with fingers and listening to the echoes. Medical imaging techniques have given us a way to look inside the body, again, without cutting into it. In the old days, if you wanted to look inside the body, you did exploratory surgery. So that has its own risks every time you cut into the body. So the next few slides show some examples of these techniques just as an interest to you who may be potentially a future healthcare professional. So Table 1.3 in your book shows various imaging techniques and what you might use those techniques for, how the images are obtained, and what are they best used for. So here you can see the techniques and the images that would be obtained with magnetic resonance, MRIs, or computed tomography. Here's ultrasound, and here's coronary computed tomography, angiography scan, positron emission tomography, or PET scan, endoscopy, radionuclide scanning, and so on. This is the end of Chapter 1 PowerPoint.